I'd like our motto to be that it's about the patients, that we do the procedure that's best for them. We do a lot of procedures here. We're doing glaucoma surgery, we're doing cataract, cornea transplant. We do it at the Fredericksburg Ambulatory Surgery Center. Cataract surgery is probably the most prevalent surgery in the world right now, especially in the United States. Cataract is just a lens inside your eye. As you get older, it gets cloudy, and most patient comes in when they say, I can't see very well, I can't drive at night anymore, I can't drive during the day, and I can't read what I want to unless I turn up the light, and even that, it doesn't work, and that's when it's indicated to consider doing surgery. It's a very simple, fast surgery. You basically go in and you remove the cataract with just the old lens, and you put in a new implant for the patient. The thing about cataract surgery, majority of the time you're awake, and it takes about 10 or 15 minutes, maybe 15 minutes to take the cataract out and put in the new lens, and then you pretty much go home right afterwards. We have the traditional implant and we have the premium implant. And the premium implant allows you to see kind of far and kind of near as well, and also correct for astigmatism and get you less dependent on glasses. The two big implants that are out there that allows you to do that are the accommodative lens, which is called the crystal lens, and the other one is the multifocal lens. Crystal lens are for more younger patients who are more active, and it gives you good distance and it gives you a good computer without having to wear glasses, where the multifocal lens are more for the older people who aren't as active and they really like to read. For some people, they describe it to be an HD, going from a normal TV to an HD where everything is just in your face. The colors are a lot more brighter, things are jumping out at you more versus when you're looking through a cloudy cataract. Glaucoma is a disease in which the eye pressure starts to increase over time. It starts destroying the optic nerve, and people start losing their vision, their peripheral vision, and then their central vision. It can happen to anybody, but particularly and most prevalent is the elderly population. You can prevent it from getting worse by lowering the pressures. You can actually do lasers in order to lower the pressures. Some people have a hard time with eye drops, and laser is an alternative for getting rid of eye drops. We also can do glaucoma surgery, and there is a glaucoma procedure that can be done in patients who have cataract. During the time that you get your cataract surgery, we put in a little shunt. Once you put that little shunt in, it actually lowers the pressure and sort of create an outflow for fluids to go lower. However, it's not for everybody. If you have a very advanced glaucoma, it probably wouldn't work as well. It's more for people on one medication, well controlled, and you don't want to take your eye drops anymore. And this is the one time that we can actually get you off medication and keep the pressure low. It just basically stops the glaucoma from getting worse. Glaucoma treatment is prevention. If you can, pick it up and diagnose it early, get on medication, then you are pretty much can preserve your vision for life. The other surgery that we also do is the cornea transplant. We're doing the partial transplant, where people have a corneal disease such as, we call it Fuchs corneal dystrophy, where the cells in the cornea is just not working as well as they age. And so their cornea becomes cloudy and they just can't see anymore. Now the new procedure is coming out where we're transplanting only the cells inside the eye. There are no sutures involved, and the recovery rate is much faster. And there's no sutures, so we don't have to actually fine-tune that cornea as much. And also the rejection rate is much lower. That's not many patients out there that have corneal disease, so it's not like cataract surgery where everybody can do it. So certain people have this condition, and because I'm cornea specialist trained, so we were able to bring that here to Mary Washington, and the people who are working with me are well trained to do that procedure. The outpatient surgery by Mary Washington is great. People are very nice there, so a lot of the patients are very happy going there as well. We try to get the best technology and the best procedure into Marion, Washington to give it to the community the best that we can.